4 Americans just over the U.S.-Mexico border looking for more affordable plastic surgery options at a clinic in Matamoros. 2 of them kidnapped and killed on March 3rd. The other 2 finally released. But before it was over, there were calls from Washington, D.C. to send in the U.S. military to intervene.
We're going to unleash the fury and might of the United States against these cartels.
Finally, the Gulf drug cartel confessed, even apologizing, admitting the Americans were confused for rival gang members.
It's a brand new laser. There's only 2 in the United States.
The people that went to Mexico, they were going to get a gastric sleeve as well as some cosmetic surgery, and we're talking again a savings of $3,000 to $4,000. So, yes, that's important for somebody, but I mean, so's your life.
Dr. Harry Bafidas is a board-certified general and plastic surgeon practicing for more than 30 years in South Florida.
It's uncanny how somebody would put their face and body on the line to save $2,000 to $5,000. And, you know, that makes no sense.
Even so, Dr. Bafidas sees several cases every quarter. Bad outcomes, he says, from botched procedures abroad.
Well, I've seen everything ranging for poor dentistry, where they have to get implants and have their teeth pulled out because of gum disease. And I've also seen terrible scars, chronic boils, and infection that continue to fester. We're talking a year or 2 later. And then asymmetry, that one side is different from another side, be it a breast, or a collapsed nose.
But in spite of those outcomes, medical tourism doesn't seem to be going away. In early 2020, Americans could, on average, save 40 to 60% by having major surgery done in Mexico. Those numbers, according to consumer watchdog group Patients Beyond Borders.
At the end of the day, you're going down there and you're placing your own health and welfare in someone else's hands. It may not be a bad idea to maybe do a little investigation.
Dr. Josh Lynchus is president of the Florida Medical Association and the chief medical officer for Broward Health.
Number 1 would be to check the Department of State website and identify, make sure the country is okay. Number 2 would be the institution. If it's going to take place within an institution, and most surgeries take place in some kind of ambulatory surgical center or within a hospital, is to check out that hospital. Make sure that it has some element of accreditation that meets similar standards, if not exceed the standards that we have in the United States. And then 3rd would be the person actually performing the procedure. Nowadays, the word doctor does not mean a medical doctor or an osteopathic physician.
Doctors Lynchus and Bafidas both recommend checking the physician's credentials, suggesting medical education and practice requirements are not universal.
They don't have our standards. In fact, they all say that we have the most rigorous standards for medical training.
A reminder to patients looking for a deal over the border that the U.S. trained standard matters.
In America, there is a consumer portal for board certification in the United States. Just because a physician practices in another country doesn't mean that they didn't have perhaps training in the States or even be board certified in the United States.